Hello, I'm Dr. Andy Beardo, the Vetmedin Global Brand Director, and I'd like to offer you all a very warm welcome to Vetmedin Live. We've developed Vetmedin Live specifically for general practitioners to bring you some of the latest findings and developments in canine cardiology, helping you bring them into your clinics and to your patients, enabling you to change the lives of millions of dogs around the world. We'll start the session by presenting a video that highlights a number of studies, insights, diagnosis techniques, and treatment opportunities. Then, following a short break, we're delighted to be joined by some of the world's leading canine cardiologists for a live question and answer session. You can start submitting your questions at any time during the video presentation. Please sit back, relax, and enjoy our video presentation.
Great to have you here today. Can we talk about pathophysiology of myxomatous mitral valve degeneration?
That's one of our favorite topics. The truth is we're starting, as we all know, with a disease that is really characterized by degeneration of the valves and the chordae tendineae that support them. And because those valves degenerate, we end up with insufficiency, regurgitation, that over time progresses, and the heart responds to that by changing its size, getting bigger, both the left atrium and the left ventricle. And over time, as it continues to grow, at some point also it becomes weak, so there is systolic dysfunction of the left ventricle chamber. And then time wears on, and eventually dogs actually develop clinical signs of congestive heart failure.
So do all dogs actually develop systolic dysfunction?
Yeah, always one of those sort of interesting questions. It turns out that most diseases that cause profound dilation of the heart ultimately lead to systolic dysfunction.
Okay, and you said so the heart is getting bigger. So Adrian, is a big heart a problem, or usually we say, oh, he has a big heart and that's good, but is it good for dogs?
What we know, as Sonia has explained, is that the enlargement of the heart is part of this progressive process of the disease. So we can look at enlargement of the heart as being a warning sign that's telling us that a dog that has developed a big heart is progressing through the later stages of the disease and is at risk then of going on to develop heart failure. But what we also believe is that the enlargement of the heart itself contributes to the progression of the disease. So as the heart gets bigger, the leak in the valve that has come about due to degeneration of the valve actually becomes worse. So you get this vicious circle where the enlargement worsens the underlying disease process and actually contributes to this sort of acceleration of the disease process. So where we worry with a big heart is partly because it's an impending sign of the dog being about to have a problem, and secondly that it probably means that the underlying disease process itself is getting progressively worse.
So you see it as a warning sign, but on the other side it's also like a compensatory thing by the body.
It is a compensatory thing, and so probably the dog would not cope as well with its disease if its heart didn't enlarge. So it's almost that it's a necessary step to cope for the worsening disease, but at the same time it's a sign that the disease is getting worse. And I think it goes beyond a point. You can think of this sort of tipping point in the disease process where as the heart continues to enlarge, what started out as a helpful compensatory response actually becomes detrimental and becomes part of the process that then results in the dog going on in a later stage to develop signs of heart failure.
So Jens, the EPIC study is already quite famous study. It's one of the most downloaded study on Journal of Veterinary Internal Medicine, and that's for a reason. Can you give us a short summary of the study design of the EPIC study?
Well, the EPIC study is one of the largest clinical trials that has been done in veterinary medicine. It included 360 dogs that were in stage B2, meaning that they had cardiomegaly because of myxomatous mitral valve disease, but they hadn't shown signs of congestive heart failure yet. They were randomized to either receive placebo or receiving Pimobendan, and then the endpoint was when the dogs developed congestive heart failure. So the dogs were recruited at 36 centers in 11 different countries. So if you count the number of days in total that dogs spent into the trial, it is by far the largest clinical trial done.
Excellent. So we have a study on the preclinical phase with cardiac enlargement caused by myxomatous mitral valve disease. And what were the results of the first EPIC publication, Sonja?
Well, the results were quite exciting for us. It actually allowed us for the first time in veterinary medicine to show that if we make an intervention in the preclinical stage B2, so with cardiomegaly, we can actually change what's going to happen. And the thing we change is when that dog is going to go into congestive heart failure. We can prolong the symptom-free and, in fact, the overall survival in these patients by initiating Pimobendan in the preclinical stage. So, and then the question is, what's the magnitude of that benefit? And it was actually fairly robust. It was about a 60% prolongation in symptom-free survival, or an average of maybe 15 months for an average dog. So pretty meaningful results for a pet owner.
Yeah, I think like counting in days or in percentage is always difficult for owners or veterinarians to understand. But 15 months longer, if you take Pimobendan in the stage B2, that is clear to every owner, to every veterinarian. 15 months longer, that's 10 to 20% lifetime. That's great. And Jens, because there were so many data available, there was a follow-up publication and actually even a third one. Can you highlight us number 2?
Yeah, we had this vast database that contained really interesting data. So we said that, okay, we want to see what happens in the dogs while they were in the trial. So we examined the evolution of different clinical variables like heart size, like different other clinical variables over time, and then compared the two treatment groups. And the most striking finding of that was that Pimobendan reduced the heart size, and it wasn't something that was transient. It remained that over the entire study period. We also wanted to see that if there was a difference in dogs that had developed congestive heart failure if they had been treated with Pimobendan compared to placebo, and we found that they were identical. In the third study, we shifted the reference point in time from at the time where they included in the trial to the time point when they developed congestive heart failure. And then we went backwards because we wanted to see how different clinical variables changed and when, in relationship to when they developed congestive heart failure, we could see changes. And the overall finding of this study was it really underlined the importance of doing rechecks, to do a proper physical exam, and in particular to count respiratory rate both at the clinic and at home in dogs that are at risk of developing congestive heart failure.
So in the third study, there were kind of, from a owner's, veterinarian's perspective, how can we predict the onset of congestive heart failure? By radiographs, there was an increase in cardiac size and all of a sudden a jump in size, right? Whereas the respiration rate, that got higher, just shorter in time before the onset of congestive heart failure. Is that correct?
Yeah, more like 8 to 10 months for the X-ray changes, and then maybe 4 months or less for the respiratory parameters to shift.
Which makes sense, because first the heart adjusts and then tries to compensate, and then it's decompensating later, and then the respiration rate goes up. Excellent. So lots of data, lots of publication, but actually what does it mean to the owners, Sonja?
Well, I mean, I think it means a lot to most owners. I mean, if you're talking about, I mean, in your own words, a 15 to 20% extension in their symptom-free life, I mean, that means more dog days at home where they don't have any signs or symptoms associated with their disease, and then overall prolonged survival, because when they go into heart failure, we can still manage them. Yeah. But really, we change the time to the onset of the disease by just taking a pill twice a day.
I agree. That's really great for the owners, for the dogs. It's so important to have a good life quality. If you're asymptomatic, you have a good life quality. And then 15 months longer is really great. But Jens, there have been other trials in the preclinical phase of myxomatous mitral valve degeneration. Can you tell us about those?
This is probably the most researched area in small animal cardiovascular medicine, studying the preclinical period in dogs with myxomatous mitral valve disease. So there have been 2 other placebo-controlled clinical trials comparing an ACE inhibitor to placebo, and they examined very similar endpoints like we did in the EPIC trial. Time from inclusion until they developed congestive heart failure, and none of the trials could show a difference between the 2 treatment groups. And recently there was a third study presented that compared the combination of an ACE inhibitor and spironolactone to the outcome in dogs treated with placebo. The study design was very similar to the EPIC trial. It has been presented, and the overall outcome was that there was no difference between the 2 treatment groups.
So the delay study was about the combination of an ACE inhibitor plus spironolactone versus placebo in dogs in stage B2, and there was no prolongation of the onset of congestive heart failure, which is disappointing. But then what I heard was that there is a reduction in cardiac size and also in NT-proBNP, which have been highlighted. But what's your opinion about that? I mean, isn't that what really counts survival time?
What really matters when you design a clinical trial is how good the life of the dog is, quality of life variables, and how long it remains preclinical or asymptomatic. We use other variables to explain things that might have happened. And in case of the EPIC trial, we use the echo measurements then to try to explain a possible benefit, what caused the possible benefit. And we found that it was a reduction in heart size. But in the delay study, what they found was a difference between the two treatment groups that wasn't linked to outcome. And such an analysis, then we assume then that the reduction in heart size will also confirm the improved survival, which was not the case. So I think it's important then to link the outcome with the actual reduction.
So my take on it, I mean, again, we sort of pondered this after the results were presented, and it came to me that it's really not just about making the heart size smaller, but how you make it smaller. With Vetmedin as an inodilator, we improve the strength of the muscle at the same time as we make it easier to send blood into the peripheral arteries, so afterload reduction. And that combination with dogs with valve disease means essentially that you have less regurgitation volume and more forward cardiac output, and that's why the heart gets smaller. Whereas with RAS inhibition, maybe you decrease plasma volume, but hemodynamically, that is not the same thing, and so doesn't translate to the survival advantage. So I think it helps us understand more about this disease and how to treat it.
But at least we have one drug now that works in the preclinical trial, Vetmedin, and I think that was a nice summary of the EPIC study and other studies in the preclinical myxomatous mitral valve phase.
So Jens, the consensus statement guidelines were just republished, I mean, actually in 2019, and I was wondering if you could give us some insight into why you think that it was a timely choice to actually redo those original consensus statements.
Well, documents like the consensus statement comes with the best before date. That means that the new things will happen after the first version was published, and with time, more and more new things will be presented and also published. And therefore, I think it's appropriate that they are updated with regular intervals. And this particular example, it was updated after 10 years.
So, you know, when I read the document, I sort of thought about distilling it into like the major messages, and I think the 4 things that came out for me that I think are very important, although there's lots of really good information in the document, was 2 of them are actually related to stage B2, which always was related to cardiomegaly in the preclinical dog with mitral valve disease, but it has been refined further to reflect a very specific heart size. If your heart size is X big, that you are now a stage B2, and the first big recommendation is that now means that Pimobendan should be recommended because the evidence supports that it will extend symptom-free survival. The second change is actually related to that because heart size is now so important, and echo is considered more sensitive and specific for that. Echo is now considered the high priority test for dogs with a murmur of grade 3 or higher related to valve disease. So those are 2 of the 4. The third one is in stage C. In heart failure, now standard quadruple therapy is recommended. So Pimobendan, furosemide, ACE inhibitor, and spironolactone, because spironolactone has cardioprotective effects. And so we kind of now recommend standard, the goal is ultimately 4 therapies in heart failure. And the 4th, I think, is also exciting. It talks about the role of reparative surgery for valve disease, and that might be an option for some clients.
I think one of the most important things is the classification and characterization of stage B2 dogs that are now being defined as dogs meeting the EPIC criteria. So that means a set of inclusion criteria that would include left atrial size, left ventricular size on echocardiography, but also radiographic size, and not to forget also murmur intensity. I think just having that definition, defining exactly what subtype of dog we're talking about in this population of dogs really helps the practitioners.
So, I mean, I agree, and it really, to me, highlights the impact of the EPIC study. It actually resulted in basically refinement and a better, tighter definition of stage B2 and what to do at stage B2. And so how do you think that really helps practitioners?
I think it really helps practitioners because all of a sudden they have the tools to identify dogs that are suitable for starting Pimobendan treatment, and by doing so they will prolong the preclinical period quite substantially, and that is a great help, I think.
And I think, I mean, I really liked that it actually gave practitioners more support in that recommendation for clients. It's evidence-based on a study, but it's also been reviewed by experts in the field and actually given a stamp of approval. So I think that actually helps practitioners as well.
And consensus statements are a very good way of disseminating a large volume of information in a comparably short manuscript. And by doing so, it's a very effective way of distributing information and also value them. And what's new now with this ACVM consensus statement is that we not only grade the level of evidence, we also provide with the strength of the recommendation, and we didn't do that in the previous version.
Good job.
Thank you. So Sonja, in the updated version of the ACVM consensus statement about myxomatous mitral valve disease, there were a set of criteria how to identify stage B2 dogs. It included auscultatory findings, echocardiographic measurement, but also radiographic measurements, and in particular then the vertebral heart score and the vertebral left atrial size. Can you tell us more about the latter?
Yeah, so the vertebral left atrial size is a new parameter. It's also taken from the right lateral radiograph, like we do the vertebral heart size. But it actually is going to emphasize more left atrial size, as you might imagine. So I'm going to show you how I go through and identify the landmarks and measure that.
Oh, great.
So a right lateral radiograph, and what I'm going to highlight for you first is the dotted lines are sort of what I imagine with my eyes, and I try to find the sort of caudal aspect of the cardiac silhouette. And then I'm going to look for the caudal vena cava, both the dorsal and ventral side of it, but I'm really interested in where the dorsal border of the vena cava intercepts with that cardiac silhouette, because that's one of my landmarks. The other is I need to identify the carina, just the same way I do for vertebral heart size. And I always imagine it in two mirror halves, because the base of the carina for me is right in the middle there. And so that line from the base of the carina to that interception is actually the VLAS. And what we're going to do then to measure it is the same as vertebral heart size, identify the fourth thoracic vertebrae, the cranial aspect of it, and then we're going to redraw that line to the same size, and we're going to actually measure it in vertebral bodies. And here I would estimate to 1 decimal place that is about 2.3. And the normal for the dog is between 1.8 and 2.3, but enlargement starts thereafter. However, in the consensus statement guidelines, what was the recommended cutoff for identification of stage B2?
Well, it was set to 3.0.
And I think that's based on the prior publication. This is a new parameter. There are some studies that have looked at it, but we're still looking for more studies to corroborate its utility. But it is another tool that you can use radiographically to identify heart size.
So, Sonja, this other radiographic measurement, the VHS, would you like to show how you do it?
Yeah, so it's a very commonly evaluated parameter, but everybody has slight variation, but it's important to try to be very fastidious about our landmarks, because now we use it to also look at dogs over time. So this is modified from the original description, but what we identify, of course, first is the carina, and I kind of always think of it as two mirror halves, and I identify the apex of the left ventricle, which sometimes is sneaky and hiding, and then that's the long axis from the base of the carina to the apex. I then try to identify the caudal vena cava, in particular the ventral border, as it intercepts with the caudal border of the silhouette of the heart, and the cranial aspect of that silhouette. And I'm going to try to basically draw a line that's about 90 degrees to the long axis. And then we need to have some yardstick to measure those lines, and so we look for the fourth thoracic vertebrae, the cranial aspect, which I've identified. And we redraw those two lines the same length, and then we basically estimate their size in vertebral bodies to 1 decimal place. And so for me, if I look at the green line and the white line here, I get that the green line is about 6.1 and the white line is about 5.1 vertebral bodies for a sum of 11.2. And normal reference range is up to about 10.5. But the consensus statement gave us a vertebral heart size cutoff to utilize to identify stage B2. Is that right?
Yeah, it was set to 11.5. But that was in the absence of doing echocardiography. So it was like, if you only do radiography and you want to be reasonably accurate, then you should probably use a higher cutoff, and that cutoff was set to 11.5. Thank you, Sonja. That was a very helpful review, I would say.
Identifying advanced preclinical mitral valve disease. In 2019, new data, including the groundbreaking results of the Boehringer-Ingelheim-supported EPIC study, evaluation of Vetmedin in dogs with cardiomegaly, prompted the American College of Veterinary Internal Medicine to update their consensus guidelines for the diagnosis and treatment of myxomatous mitral valve disease in dogs. Treatment with Vetmedin at preclinical stage B2 is now recommended by leading canine cardiologists. The following simple screening algorithm, reflecting these updated guidelines, has been developed to assist you in determining whether dogs suspected to have myxomatous mitral valve disease, MMVD, are likely to meet the criteria for being at stage B2 and require further screening or treatment with Vetmedin. The first stage of screening patients with mitral valve disease is identifying breeds at risk for heart disease and auscultating the chests of these patients. The first sign that you will find in dogs who have clinically relevant preclinical mitral valve disease is a moderate to loud left apical systolic heart murmur. The ACVIM guidelines recommend that detection of a murmur by auscultation should be followed up by screening using an echocardiogram to determine if the patient has developed cardiomegaly. The measurements recorded should include left atrial to aortic ratio, LAAO, and left ventricular internal diameter and diastole, LVIDD. If either the LAAO ratio is less than 1.6 and/or the left ventricular internal diameter and diastole that has been normalized, LVIDDN, is less than 1.7, then treatment is not recommended at this time. The PET should be rechecked in no more than 6 months or earlier if the disease shows signs of progression. If the LAAO ratio is greater than or equal to 1.6 and the LVIDDN is greater than or equal to 1.7, this confirms cardiomegaly and that the dog is in stage B2 of heart disease. Echocardiographic evidence of this is considered to be the most reliable way to identify dogs expected to benefit from treatment with Vetmedin. If the echocardiogram is initially declined or is unavailable, an alternate route to confirm if the patient has an enlarged heart is to perform thoracic radiography and calculating the vertebral heart score, VHS, and/or vertebral left atrial size, VLAS. If you need a reminder on how to perform a vertebral heart score, head to www.epictrial.com. The result of the vertebral heart score can lead to several different recommendations. If the vertebral heart score is less than 10.5, the PET currently has no indication of cardiomegaly. A recheck should be scheduled in no more than 12 months, or sooner if the dog shows any signs of disease progression. If the vertebral heart score is greater than or equal to 10.5, but less than 11.5, ideally an echocardiogram is recommended to confirm cardiomegaly and the presence of mitral valves with abnormal morphology and mitral valve regurgitation. However, if this has been declined or is unavailable, the vertebral heart score should be checked again in no more than 6 months' time or earlier if the disease progresses. If the vertebral heart score is greater than or equal to 11.5, or if this is a recheck and the score is increased by 0.5 vertebral bodies for every 6 months that has passed, or if the VLAS score is greater than or equal to 3, an echocardiogram is ideally recommended to confirm cardiomegaly if the owner can now be convinced to agree to this assessment. If cardiomegaly is then confirmed, the dog is in stage B2 of heart disease, and treatment with Vetmedin should be started. If an echocardiogram is still declined or is unavailable, a presumptive diagnosis of stage B2 heart disease should be made, and treatment with Vetmedin started. Thank you for watching. Due in part to the pioneering results of the EPIC study, the largest veterinary cardiology study to date, the updated ACVIM guidelines now empower veterinarians to treat dogs earlier in the disease process, giving them more symptom-free days. To learn more about the EPIC study, please visit www.epictrial.com.
So, Gerard and Sonja, there is one study called the VALVE study, Gerard, and I do believe that you are the responsible person for this study. Would you like to outline the design and maybe give us a little peek of the results?
Absolutely, because I'm very excited about VALVE. So VALVE stands for Vasotop, which is an ACE inhibitor, on top of Vetmedin and Lasix in dogs with myxomatous mitral valve degeneration in heart failure. So it's about stage C, congestive heart failure. And as you all know, the recommendation used to be give the triple therapy. And the question that we had after QUEST was published, QUEST was about pimobendan plus diuretic versus ACE inhibitor plus diuretic. What if pimobendan wins, as it did? So what if we add an ACE inhibitor on top of pimobendan and furosemide? So everybody would guess, yeah, it gives some benefit because, well, that's how we think about it. But nobody has ever looked for that scientifically, and therefore we made the study. So we had 157 dogs randomized prospectively in a multi-center study into two groups. So the dual therapy, pimobendan plus furosemide, versus the triple therapy, pimobendan, furosemide plus the ACE inhibitor. And now everybody can guess how much time did you get in addition to what pimobendan does. Is it 3 months, 6 months, 8 months, 9 months more? Well, the result was very surprising. The addition of an ACE inhibitor to pimobendan actually was in times shorter. Not significant. It was 170 days versus 223. So basically the dual therapy, although there was no significant difference, was well, in days better than if you added an ACE inhibitor. So I would not say that the ACE inhibitor was bad, but it did not do anything. So that was very surprising, but this is another proof why we need prospective clinical trials to prove what we think is beneficial, because expert opinion based on pathophysiology, on working how, on the knowledge how drugs should work, is often not actually what reality shows.
Very, very interesting. And Sonja, there is a study called the SHIELD study. Would you like to give us an outline of the study, the reasons why we do the study?
So it is so unlike Valve and EPIC and Quad, it is retrospective. And it's because the question it's trying to answer is actually trying to look at dilated cardiomyopathy in the occult stage, right? So before the animals are sick, in all breeds of dogs. So if I remember, remind you, the PROTECT study looked at Dobermans specifically, right? We said Dobermans in the occult stage of the disease, if you initiate pimobendan versus placebo, you can extend their symptom-free life by about 60% and their overall survivals. And we know that in Dobermans. And then we actually have another publication that looked at pimobendan against ACE inhibitor and digoxin in Irish Wolfhounds, which showed, again, a benefit to pimobendan in the occult stage of the disease. 2 different breeds, but everybody wants to know, what if it is Golden Retriever or German Shepherd or Dalmatian? And we can't do all those studies. And so maybe what we could do is look back at the group of dogs retrospectively and identify a group of dogs that got pimobendan in the occult stage versus a matched group of dogs that did not get pimobendan, and try to answer the question whether or not overall there is benefit to pimobendan in the preclinical stage if you look at a large mixed population. And so it is difficult to do these types of retrospective studies. This is a global study. There have been dogs submitted from multiple countries around the world, and we are in the analysis stage of the data. So we're excited, but there are challenges that we face.
Interesting. And then there are also there's another study ongoing that refers to the Prince of Denmark, the Hamlet study. I believe both of you are involved in this study. Would you like to?
So Hamlet is about to be in B1 or in B2, or not to be in B1 or 2. We are happy that we can say we finished the study. We included thousands of dogs. I don't want to come out with the final number of dogs. Okay. It's still a secret. But so the study is finished, and stay tuned to the results. Will be very interesting.
Interesting. So all of this is extremely exciting, and I think we are all looking forward to see the final results and the publication of these studies. So thank you so much.
Let's talk about challenges that primary veterinarians have in practice. So you have a dog that has no symptoms, and now the veterinarian says, oh, I have this drug. How would you convince the owners to give the drug, despite the fact that the dog is still normal?
So I agree. I think the challenges faced by primary care practitioners or first opinion veterinarians is very different than the kind of patients I see in practice. And so I understand that. For me, the way I would probably approach it is I think you have to talk to owners about what they would be getting if they decide to go ahead and give that pill twice a day. And so you'd have to talk about the fact, again, that we're trying to make them live longer in the symptom-free stage. And what that means to them is that, I mean, I'm going to flip it from the 15-month thing we talked about to, I don't know what your dog Fluffy's crystal ball is. I don't know how long Fluffy is going to live with this disease. On average, it's years, and we can make it longer. But I do know that I can change that dog's risk of developing congestive heart failure. I can reduce it by 1/3 every day for the rest of that dog's life. And that's a pretty meaningful event for an owner, to know that they're not going to face congestive heart failure for some period of time that is much longer than what they would have faced. And so you try to, again, convince them based on the facts that this medication has been shown to have benefit.
Okay, what about if you flip it to the other side? If you say, what about yourself? Would you take a drug that makes you live, let's say 10%, 10 years longer without symptoms? Would you take this pill if I give it to you? Would you?
Well, maybe not from you, Gerhard, but if my doctor told me I took this pill, it would change how long I would live, and in fact, I would live, absolutely. I mean, I think people do that all the time, and we know that heart disease is very treatable in humans before you ever get sick. Blood pressure reduction for hypertension, antiplatelet drugs if you have blood clot risk. I mean, this is a known thing, and people do take medication all the time.
Yeah. But Jens, what if they refuse to take this drug? How would you argue?
I will probably bring it forward pretty similar as Sonia did. I would say that if I were you and this was my dog, I wouldn't hesitate for a second to start treatment. I think that it's very important then to communicate with the owner and explaining them exactly what goes on, and that the fact that even if the dog is not showing signs of disease now, it might very well do so in the future, and we can prolong the time where the animal is free from clinical signs. And this is, as a matter of fact, for the owners, this phase in the dog's life is probably much, much more interesting and important than the time from when the dog starts to show signs of clinical disease, meaning congestive heart failure, until it becomes so sick it has to be euthanized or it dies spontaneously. So I think just explaining the amount of time we're talking about, the time frame in relationship to other phases, and then also a discussion a little bit about the cost. I think, in my opinion, I don't think I even had one owner that refused after that.
So is it not sometimes a challenge to explain that not seeing a change to remain normal is actually the benefit of the drug?
You know, I mean, I guess when they're coming in with that dog and it has no apparent clinical signs, I'd say, are you happy? Is your dog happy? Are you happy with your dog? This is what I want. I want this dog to remain this happy, healthy dog, and I want him to do so for an extended period of time. I think saying that, reminding them that this is what I want to sell you. I want to sell you this dog like this today for a longer period of time. I mean, that's. You have dogs? No? Do you have a dog? I have dogs. I have enough dogs for everybody. I would tell you that the preclinical time, I mean, that time when your dog is young and feels well is wonderful time, and I would probably do just about anything to have longer of that time.
I agree, and it doesn't matter if you have dogs or cats. We all have a lot of clients with pets, and what we want is to maintain a good life quality. But I think veterinarians in family practice, the first veterinarian, they challenge different situations than we do. Because if I have an owner coming to me, I've never had the situation that when I say, I have now pimobendan, we give that once the heart is enlarged, then your dog will live 15 months longer on average. I've never had the situation that they are refusing. But I hear that sometimes from colleagues, that they say, yeah, but they, for any reasons, I don't want to start that. So we want to help with this discussion our colleagues out there. So if I summarize that, one would be with evidence. Evidence always is good for the owners. You said you can reduce the risk about 1/3. Jens said, well, if we can maintain the size or the status right now, that is good, because that at the end will come out with 15 months longer on average. Do you have any other argument that we could give the owners?
I mean,
the veterinarians out there for the owners?
well, we have guidelines. So the consensus statement guidelines were republished in 2019, and it's exciting. I mean, I think the real impact of the EPIC study is the changes that occurred in the new consensus statement. And so I think, like in human medicine, where there are guidelines, it actually can be very useful to, assure the owner that this is not just their recommendation, that this is the recommendation based on good evidence, but also of a peer of experts in the field who also recognize that evidence. So, I mean, the consensus statement says the same thing, that we should start the medication in stage B2 because it changes what's going to happen. And so it's nice to lean on the expert opinion too.
And I think it's also about how convinced are yourself by giving any drug. Are you convinced just because somebody told you should do that, because they have a nice brochure or whatever, or are you convinced because of evidence? And we are in a century now where we are more and more and more on evidence-based medicine, like in human medicine. Now we have class 1A recommendation based on the EPIC study to give pimobendan in that stage. So if the veterinarians are convinced, yes, there were good studies, I need to give that, then I think it's not a problem to convince also the owners to give that. The challenge is probably to let everybody know about these results, and this is one reason why we are doing this one.
And one last point, which we actually always jump over because pimobendan is such a well tolerated and safe medicine, but the EPIC study also showed us very nicely that there was a very good very few side effects, no more than in the placebo group. So owners can't expect to have any negative outcome associated with taking the medicine. So that's also important. It's very safe and well tolerated and has been used for 2 decades now in veterinary medicine. So good safety profile on top of everything, icing on the cake.
So now we have collected a few arguments to help our colleagues out there how to convince owners that it is beneficial for their pets to give pimobendan.
Thomas. Hello, Molly. Hello, girl. So, the last time you were in, I had to listen to Molly's chest and heard what we call a murmur. This suggested that she may have early stage heart disease, so we did some further tests, which have now confirmed this.
Heart disease? That sounds really bad.
I understand this must sound very concerning, but let me explain it to you in more detail so you understand exactly what it means. Molly has developed a leak across one of her heart valves, and this affects her heart's ability to pump blood effectively around her body. When I listen to her heart with my stethoscope, I can hear a whooshing noise, and that's what we refer to as a heart murmur. Molly's heart valves aren't functioning as they should, and some of the blood is leaking backwards across the heart valve rather than being pumped forward around her body. The heart murmur is caused by this backwards leakage of blood across the heart valve. Let me show you. This box contains different sounds of hearts, both from dogs with normal hearts and dogs with heart disease. Have a listen. This is a normal heart. And this is a heart murmur. It's similar to the noise that I can hear in Molly.
That sounds really serious, but she seems so well.
Yes, in the early stages of heart disease, dogs can outwardly seem typical, normal, but it's really important to understand that changes are happening on the inside. But as we've caught Molly's heart disease early, there are things that we can do to keep her feeling active and healthy for as long as possible.
Oh, that makes me feel a bit better. What exactly did you find in the tests?
Right, so the tests that I did were a chest x-ray to measure the size of the heart and an echocardiogram, which is also known as a heart ultrasound, to see the inside of the heart structures like the heart muscles and the heart valves. Both of these tests confirmed early stage heart disease.
So you can treat it?
Fortunately, due to recent research studies, We now understand a lot more about heart disease than we used to, and there are new treatment approaches to help control the condition.
What type of treatment?
Okay, so it's a combination of lifestyle, monitoring, and medication. We can give you advice on things that you can do with Molly's diet and activity, and as far as medical treatment goes, we recommend a drug called Vetmedin, which can help dogs like Molly.
You suggest we start her on this medication now?
I strongly recommend we begin treatment right away.
Why now when she looks fine and is acting normally?
Well, by starting the treatment now, before she has any outward signs of heart disease, we can slow down the progression of the disease and keep her symptom-free for an average of 15 months longer than if we don't start the treatment, which means Molly can live a happy, enjoyable life.
Okay, that sounds good. What else can I do?
Well, as well as giving you the Vetmedin, my team can discuss dietary and exercise recommendations with you, plus we can both monitor her breathing.
Why monitor breathing? And can I do this at home?
Monitoring Molly's breathing is a really good indication of how well her heart is functioning. At home, we'd like you to count how many breaths Molly takes every minute while she's resting. It's really easy, and there's an app that we can show you how to record it. If we see that her breathing rate is more than 30 breaths a minute when she's resting, that would suggest that we'd want to see her again as soon as possible.
Okay, I can do that, but how will I know if the medication is working or if the heart disease is getting worse?
Well, the best sign that the medication is working is that you don't see any change in Molly's activity or significant changes in her breath rate. She should continue to be her happy, relaxed self. If you do notice that she's tiring on her walks or her breath rate is increasing while she's resting, that would suggest that the heart disease is getting worse, and so we'd want to see her again as soon as possible. So that pretty much wraps everything up. Do you have any other questions or queries?
Okay, that is a lot to take in all at once, but it does make sense. Let's start the treatment you recommend, as I want the best for Molly.
Good. If you have any questions, give us a call at any time. Otherwise, we'll see her in 3 months' time for a heart checkup.
Okay, thank you very much, Doctor. I'm very relieved to know there's something we can do to help Molly.
No, you're welcome. You're welcome. We'll see you both in 3 months' time.
Hello again. I hope that you found our video presentation interesting and that you are able to use much of the content in your work. It should prove particularly helpful with managing the often difficult conversations we have with pet owners whose dogs are asymptomatic, when we know, through evidence-based medicine, that we can significantly improve and extend their lives. We will now take a short break. I look forward to seeing you back here for the live Q&A session. Thank you.